folks. Good evening again. We're back around the table with We the People of RI. Our esteemed guest, we have Joe Procaccini, Doreen Costa, Paul LaRue. We're talking about health care, the health care bill that was just passed yesterday. So, my three things before we went to break. They say that this is going to be a it's only going to cost $942 billion. 32 million Americans that aren't covered by health care are now going to be covered. But it's not going to cost the American people. It's not going to cost any more. How can that be? How can it be? The number is 942 million right now. There's 32 million people that aren't covered that are going to be covered. Where is that? How can it not be more expensive than $942 billion? And it will be. Now, out of the 32 million that aren't covered are the younger generation, the demographic of, 20 to 25-year-old younger college kids who aren't covered because they choose not to be covered. Now, you are going to be forced to, and I have questions on this too. I'll let you guys talk, and then I have a couple questions. But now, out of that 32 million, the demographic of 20 to 25-year-old Americans that choose not to have health care, even in other demographics who just choose not to have health care, what is that? I mean, what percentage is that? Is that maybe 15 million out of the 32 million? But at this point, it doesn't matter because this bill says even if you don't want it, you have to have it. Is that true?
Yeah, I mean, I'm not sure of the exact numbers, and I'll defer to my colleagues on the other side of the bench here. I'm not necessarily a numbers man, but I do see the essential unfairness of forcing people to buy things when they're least able to afford to do it. Now, here's a fact. If you go to work for a smaller company, they will not be forced to provide you with health insurance, but you'll still be forced to have it. Now, when you're first starting out in the world and you're 20, 25 years old and you don't have a lot of money to put into this, what's your choice? You're either going to pay for something you really can't afford, or you're going to pay the fines and get whacked with taxes, and they're going to take money out of your returns when you most need that money. I remember being 20 to 25 years old. I remember not having a lot of cash available. I remember feeling that kind of vulnerability. And there's somehow their idea of helping all the young people in this country, and my oldest daughter who's about to graduate from college is one of those people, their idea of helping is to force them to take something that they don't necessarily need, and they've already clearly stated in many cases that they do not want. And, this is what troubles me the most. It's not the shady backroom deals. It's not the way they've rammed this thing through. It's the fact that nobody wants this, except the people who aren't going to actually be part of it, who are pushing on those of us who said that we don't want it in the first place. And there's absolutely no reason to have any of this.
I completely agree with you on that, Paul. And the bill is not about helping people. I mean, that should be obvious. Yes, it's about control. It's about shrinking the middle class more. It's about helping big pharmaceutical companies, the health insurance companies, and and the politicians and bankers too. There's a website, OperationHealthFreedom.com, and there are some really good bills on that site that would help improve the healthcare system that we have in this country. One of them, and I don't know the bill off the top of my head, it was sponsored by an Arizona congressman. Basically, the bill would allow people, it would break down any barriers that prohibit people from buying health insurance across state lines. So you want to buy health insurance in another state, your state and the other state and the federal government can't interfere with that, and that would open up competition in the health insurance business. And Ron Paul has a bill on that site, basically making all medical expenses 100% tax deductible. So for anybody, those are just two starting points, and there's at least one other bill on the site too. So I recommend people go to that website, OperationHealthFreedom.com. We also need to be aware of the fact that for years they've been trying to build a North American union. There's plenty of evidence to back this up. They did it with the European countries. They did it with the African countries. 2 years ago, they did it with the South American countries, and now they're doing it with the Asian countries. So we need to, keep an eye on that. We also need to keep an eye on Codex Alimentarius, which will also interfere with your health freedom. There's a lot of bad things in Codex Alimentarius. In particular, it would make dietary supplements either illegal or available by prescription only. That's something that we need to keep a close eye on. So, and there are other bills in Congress as well. You want to add something, Doreen?
Well, you're so right about other things going on. I mean, right now everybody is focusing on healthcare reform, and I think we need to focus on the economy. We have to go back to the economy. Healthcare reform's passed. We all need to contact Patrick Lynch and pass the mic. We all need to contact our Attorney General Patrick Lynch and see if he'll come on board one of the states. I've called his office today. I've got no call back. I've also called Jim Langevin's office to find out when he's coming back because I want to have a welcoming home party for him. That data was not available yet. But as far as the economy goes, I know that there's some candidates out here who are thinking about running for office. We have a 10th Amendment rally on Saturday. I am running for office. I'm running for a rep seat in District 31, which is North Kingstown and Exeter. And my contribution to the economy is everything I've been buying for my campaign, I've been getting it within my community. Whether it be my yard signs, my bumper stickers, my pins, my pens. Anybody else that's running for office, I suggest you do so. That's going to help the economy in your community. You might be able to save $3 or $4 if you're buying on the internet, or if you're getting it from overseas and you think you're getting a deal, but you're going to pay for shipping and you're really not getting the deal. So put it back in your community, put it back in the economy, help the small businesses. Share their names with other candidates that are running in your district, or in your whatever, in your town, throw off the state. Just share it, Facebook it, email it. Let's keep everything in Rhode Island. Let's keep everything you buy in Rhode Island. Forget the internet right now. We need to grow our economy here.
Bob, I'm almost set. Something to add, Paul?
Oh, good. It's working again. Awesome. Somehow the magic touch here, right? Here's the thing that's occurred to me. Now, there's a lot of people that are saying, well, this will be really hard to repeal health care, just getting back on the topic at hand. And I know that would be true, because even if enough decent, patriotic people who actually support the Constitution manage to take power in Washington back away from the criminals that we've got there now, okay, you still have the chief criminal and all of his tax cheats and cronies in the White House who will veto anything that's passed. But here's a thought. You can't run a program without funding. And what should happen is that every politician who's running for national office in this country should be held to a promise that they will shut down funding for this monstrosity. You can't run this machine without fuel, and their fuel is our money. And it needs to be shut off this November.
About it is this healthcare bill was posted, and we had 72 hours to read this before it got passed. I personally read 7 pages. I don't have time because I work full time and I'm out campaigning. He's saying, the president is saying it's not in the bill. Nancy Pelosi is saying that's not in the bill, but you can't believe anything that they say. Or so if anybody knows that if the illegal immigrations or the illegal immigrants are going to be covered in this bill, please let me know, because we need to stop that, and we need to focus on our children and not the illegal children and the illegal adults that are in this country. I mean, and the criminals also. I actually would love them to come into this country, and I would embrace them, but they need to do it the right way. They need to go to school. They need to go to class. They need to learn the language, because if I go to their country, you will not hear press 1 for English. I can guarantee you that, okay? You're in our country. You learn our language. Come here legally. Grab your papers. God bless.
Hey, Doreen.
Thanks, Doreen. Okay, we'll be back after these messages. We have one more segment, and we'll be back in 2 and 2. I'm dying to say that.